I would like to introduce Dr. Molly Lopez, who is the director of the Texas Institute for Excellence in Mental Health. Dr. Lopez works with all agencies across the mental health system, the mental health ecosystem. She works closely with the Health and Human Services Commission, helps to provide leadership for all of us in the mental health space with the Texas System of Care, working with the Texas Child Mental Health Care Consortium. And there are many other leaders as well as Dr. Lopez from other agencies. But you're going to meet all of the leaders as we go on through the 3 days. But this morning, Dr. Lopez is going to help me kind of walk through, giving you a high level 30-minute overview, and then another 15 minutes of a little bit of a deep dive into a couple resources that we want you to have access to. And we're going to give you a high level 30-minute vision of what we've worked on across agencies with many people, colleges, universities, educators, principals, mental health professionals, to kind of develop safety professionals. And let's talk about where we're at a little bit on educator and student wellness and setting that up. So if we could just move the slides forward, we'll do a little bit of level setting. One thing I really like about this slide that we put in here is, you heard Dr. Harvey talking a little bit earlier about stigma around mental health. And, mental health, we all have it. And it's on a continuum. Some days we have good days, some days we have bad days. It's all mental health, right? And I like this because the CDC in 2020 came out with a nice definition as we try to remove stigma and say the words mental health. So mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make healthy choices. Now, mental health is important at every stage of our life, from childhood and adolescence through adulthood. And mental health is equally as important as physical health. Now, this shared definition for mental health has been put out there by the CDC and has been picked up and shared by many organizations and advocates for mental health for all. And so we wanted to level set with that this morning. Now, Hank talked a little bit this morning about the Safe and Supportive School program, ensuring physical and psychological safety. And at TEA, we work to connect our mental health work into the Safe and Supportive School program as we team together that Hank talked to you about. So you're going to hear more about the Safe and Supportive School program, definitely writ large on the 3rd day when you do meet our Safe and Supportive School program manager, Shane Sexton. You're going to meet leaders and people from programs all through the next days, as well as school districts, mental health providers, leaders of nonprofits. But the Safe and Supportive School program was developed by Senate Bill 11 in the 86th Texas legislature. And at TEA in Kelvy's office and in the Division of Safe and Supportive Schools, it was developed this kind of definition to help build it out, that a safe and supportive school program is a systemic and coordinated multi-tiered support system that addresses school climate, the social and emotional domain, and mental and behavioral health and wellness. It includes collaboration with community or external organizations, conducting behavioral threat assessments, and the implementation of a multi-hazard approach to prevent, prepare, respond, and recover from crisis situations. Now, this is not a complete school safety conference. We won't be getting into all of the angles of all of the elements. We're going to be focusing on the mental and behavioral health collaborations components. Some of our leadership at TEA sat around with the commissioner one day early after Senate Bill 11 passed and drew this out, that before Senate Bill 11, we had disconnected efforts in our state for school mental and behavioral health and school safety and security and academics and learning supports, and then realized that Senate Bill 11 helped us begin to pull it all together, as the next slide shows, so that we would work together more systemically and in a coordinated way, and realizing, back to the CDC definition, that our mental health is part of who we are. and it helps support our academics and our learning supports. It helps support our school safety and security. And school districts have the opportunity to be able to make lots of local decisions with targeted and aligned funding in order to meet their own needs, to coordinate amongst school safety and other professionals. So what we do then, when the mental health and wellness team was established under the Supportive Schools program, we work to support our leadership with planning and program policy analysis and implementation and evaluation, helping to ensure our statutory requirements at the agencies is communicated well for mental health. We work on a lot of interagency coordination, such as with Dr. Harvey's group and all those programs that she talked about that we'll be learning more about over the next few days and seeing examples of in communities and schools. We do direct and oversee the Project Aware Texas grant from SAMHSA. Aware means advancing wellness and resiliency in education. We're all about that hope. And that was a grant that TEA and our partners applied for after Hurricane Harvey, with the realization from the governor and the commissioner on the needs that students and families and schools were having with such disasters. We also work to develop and pilot mental health resources and tools for school systems, provide training and technical assistance, working with our Education Service Center partners and all kinds of other partners in the community, such as with Dr. Lopez's group at the University of Texas at Austin, the Child Mental Health Care Consortium, HHSC, and our Title 4A partners in ESC 14, who also works to provide training. And there's so many partners that we can't mention all of them right now, but we're going to hear a lot more later. So with that said, Hank mentioned that there is an effective district framework all being developed, and a school framework, also effective school framework being refreshed. And as all of these things are developed, the agency continues to work hard to align our work and our mental health work. And the driver that we're really seeking is for all students to be ready to learn, right? We want all of our students to be ready to learn so that they become college and career ready and have safe and supportive and strong futures and visions for their future ahead. So we help contribute to that with our mental health and wellness work. So we'll talk more about that at another time. On the next slide, we just want to show you a big picture that we work at TEA, many of us at the agency and on our supportive schools team and in our mental health team. We do serve on the statewide behavioral health coordinating council, where we help with goals and statewide goals for the Texas legislature on how to increasingly measure and coordinate our mental health work, our services and our resources. We work on the Children and Youth Behavioral Subcommittee that advises leaders out of the Health and Human Services Commission as well. We have a group, it's called Unified Services for All Children, that TEA and HHSC developed together many, many years ago, so that state agencies could sit down in a comfortable space and be able to build relationships so that we can coordinate. Building relationships is an important feature and a foundational feature to behavioral collaboration. Dr. Harvey mentioned community resource coordination groups, and I do want to make sure that everyone in this room leaves knowing what that is and hopefully participates and engaged. We're also involved in the Collaborative Council for the Judicial Commission for Mental Health. And while this conference, the commission recently had a conference focusing on judicial mental health needs in the judicial system, and that's a whole nother specialty area. But we work with them because many of our students are involved in the juvenile justice system. And we'll have webinars and additional information for you about that as we take deeper dives even after the conference. And we also work with a collaborative task force on school mental health services that the legislature and the commissioner established to help study, learn more, and to kind of evaluate what we need and where we're going and how we're doing with some of our mental health services and supports in our schools. So those are some examples. I really want to shout out our ESCs. We have 20 education service centers in Texas, and those 20 education service centers who we work with at the agency really our arms and our legs out in our regions. Want to make sure everybody knows we have 20 regions throughout our state, and each of those education service centers have appointed people, teams who work together in the service centers, who are so awesome, and they provide training and technical assistance in school mental health practices. They have modules that we have developed with them and done training on, also around building and leading trauma-sensitive schools, and other things. We have a Title IV-A initiative at the agency that supports the work of the mental health and safety teams at the ESCs. So they're able to support the school districts in their regions. One of the things our team does is also work with the ESCs to make sure that they've got some funding to be able to turn around some of their learning, support and pilot and get feedback from school districts. So we do have an ESC behavioral health grant where our 20 ESCs have a cohort of over 100 small and rural districts that they work with to pilot evidence-based practices and school mental health practices, and get feedback from the schools and build relationships with their community partners. And they do a lot of training and coaching and support for implementation. So everything that we're going to talk about today, lightly in the light touch in the next few minutes, education service centers are equipped to take deeper dives in. So I'm going to go lightly on this. Are you going to have all of this information, this entire PowerPoint? So you don't need to take any notes, but we just level setting want to make sure that everyone is aware that within any multi-tier system of support, we would have MTSS services and components for mental health and wellness. And so one way to look at that is at the base of what we do is to have family and school and community partnerships, to have policies, protocols, and professional development. And then that we also would then make sure that we have universal prevention and promotion for all students in our schools, so that we're building that safe and supportive school climate for everyone, that we all know trauma-informed practices, and that we have activities just to support the overall wellness of everyone. And then at the tier 2 level, you kind of think about that, and you're going to learn more about this over the next day. We're going to have more targeted supports and early intervention for the students who need those supports, who have some at-risk needs that have been identified. The family is requesting some mental health assistance. And then also at tier 3, that's where we get into the treatment and some more intensive services and partnerships with community providers, also for students with serious concerns. That might include some connections with our safety resources and our school safety plans and other things. But when you think about this, we're basically talking about supports that are for everyone, some supports that are a little more targeted, and some supports that are pretty intensive. On the next slide, I just want to show you a different vision. So if you workshop this with mental health professionals, because as you know, the brain is different for each of us. So people's brains see things in different ways. So here is one way a mental health group thought about what school mental health should look like. It doesn't really matter if you see it in a circle or you see it in a triangle. Some mental health people, as we work with multidisciplinary teams and views and visions, see that you build a school community and a whole community, a larger community of partners who implements evidence-based practices and surrounds the students and the teachers and the families with these evidence-based practices and relationships. So they think about the outer circle as systems of prevention and promotion. The statute talks about that. When it talks about school mental health, that all students receive that safe and that healthy school climate and that culture with age-appropriate social, emotional, behavioral skill building, supported by universal screening for needs and established referral pathways, so students can get the support they need, and families. And then kind of within that wrap around, systems of early intervention for those at-risk students needing some more help, more interventions, and in that targeted classroom support, or small group support with school counselors, mentors, an individual mentor. Dr. Harvey talked about that. It could be a teacher, a janitor, a cafeteria worker. Our students connect with many, many people who can give students extra attention. and also systems of treatment to be sure that we plan ahead of time, that if students need more in-depth interventions, safety plans, more wraparound services, and school-based or community-based treatment, that we make those connections and build those relationships. And always in our foundation, we work with data and our school and our family and our community partnerships that we build over time. And this kind of ecosystem, when we think about it this way as a community, is built over time. So everything Dr. Lopez and I are going to talk about in a minute, it's one step at a time, whatever meets your need locally. Kelvie and Dr. Harvey and Hank talked earlier about different frameworks that exist. This one was developed many years ago after Hurricane Harvey, with a team of experts that looked at some essential elements for Texas school mental health, built off of the National Center for School Mental Health research, the PBIS and the Intersystem Connected Systems Framework, and looking at the Texas statutes, how to pull together and help schools kind of visualize what we do. So within that, we have a multi-tier system of support for mental health. We're going to talk today about some school mental health components, foundational steps, and pathway to quality school mental health systems. Next slide. And I am going to transition to Dr. Lopez now, who's going to talk to us about some resources, and we're going to kind of walk through some steps for you to help visualize and have a shared vision a little bit further. Dr. Lopez?
Yes, thank you, Julie. And hello, everybody. It is really a privilege and an honor to be here with Julie, to hear and share some of the work that's been doing. As Julie was talking about it, I just want to reflect a little bit on all of the partnerships and collaboration that was embedded in all of the things that she was sharing. You know, collaboration within the agency across different divisions and units to try and make everything aligned and clear and easy to follow and to support, and all of the collaborations that have gone into developing a lot of different resources. And so just excited to be here with you all today to kind of continue and talk for really 3 days about all of the collaborations that are possible. We're going to show you, and I just wanted to kind of have it up here on the screen, some examples of things that are available to schools, to districts, to communities to help support this work. And so you can find these resources that we're going to just highlight just a few at the School Mental Health Toolkit at the website, schoolmentalhealthtx.org, as well as the School Mental Health Guide, which has a lot of more detailed and really great information to help you think about how you're going to do your school mental health work. All right, next slide. We're going to talk a little bit about the pathway to quality school mental health. And if you remember that picture, that framework that Julie shared, it was the pathway up to the multi-tiered system that was pictured in the schools. And so this pathway is going to be kind of what we're going to talk just a little bit more about. And we'll start with the next slide on teaming and planning. That's an important first place for us to start. Okay, next slide. All right, so teaming and planning is really the one of the most important things we do to support school mental health. That's when we bring together multiple perspectives from different areas of the school and even from the community to really inform how we are developing our school mental health system. Those teams, and it may be one team or it can be multiple teams, they are there to help plan for our system, to ensure we have the right partners that we're working with, to help ensure we have the right training available to our educators, to our school staff, to our mental health professionals, and to make sure that we are continuing to improve our school mental health system. That team is helping to make sure that we are meaningfully engaging our students and our families to be a part of that planning process, to inform what is really most needed, what is most helpful, what is most useful. And that team is facilitating those effective school and community partnerships, ensuring we have the right people we're partnering with and that those partnerships are smooth and working well. Additionally, those teams are creating structures at each tier of our multi-tiered system for mental health. They are making sure that we are thinking about what we're providing to all students, how we're addressing the early needs of students, intervening early, and then how we're making sure that we are getting the appropriate resources to those students who may need more intensive services and supports. Those teams are also thinking about kind of how do we define what staff roles are, what each different member of the system's responsibilities are. So we're not stepping on each other and we're efficient. We're not all doing the same thing, but we're really making sure we're using our resources wisely. And then that team is also making sure that we are having effective referrals, both into our school mental health services and to our community-based mental health services. So really important, critical piece of the overall work.
I just want to
Sure.
say, we're going to throw up some examples here and there. One thing that helps ground us and ground these relationships and articulate our roles is when school districts and community agencies and partners have a memorandum of understanding. And for example, between our local mental health authorities, you're going to hear a lot more about that later. Those are run by the Health and Human Services Commission and also local communities. These are local community centers that kind of form the base of our mental health system in Texas. And we've worked to develop memorandum of understanding between school districts and local mental health authorities, so everybody kind of knows what everybody is doing and what to expect, whether it's in a prevention scenario or a crisis situation. And so I just wanted to shout out the concept of a mental health memorandum of understanding with our community partners. Relationships are so important and these take time to build. And so as we talk through this and we show you some examples of tools and resources, and if you're with a school district or a community agency and you don't have all these things yet, we don't want any stress in here. We want to just make sure kind of everyone thinks about some of the components that we can put together to help strengthen our work together for all of our mental health. Molly?
All right, so the next thing we're going to talk about is a needs assessment and resource mapping. Those are important processes too. Our needs assessment is the way that we are identifying what are the most pressing mental health needs for our students and even our staff, and identifying kind of at this moment, what do we have in place? Those are our resources. What's in place within our school? What's in place with our community partnerships? And are they meeting the needs that we are seeing right now? It could be that there are new needs that we need to address. So this is sort of an ongoing process to continue to make sure that we have both our needs understood and that we've got the right resources at the table. This is where we identify and we leverage the strengths that we have in our community and in our schools. And it helps us plan for the priorities for that upcoming school year. What do we need to do with our school mental health programming to make sure that we're really meeting the needs? Those things that we identify in our needs assessment as being important priorities then can inform our district and our campus improvement plans to make sure that those things are really being aligned well. So let's look at some examples.
Yeah, this is, with Project Aware, which is a SAMHSA funded grant that was helping us to pilot some of these practices, and you're going to hear about this in some school districts, and also others extend it, and also to be able to sit around the table and develop with our state level partners across systems some resources and tools to build statewide infrastructure. You're going to see some samples, and we've collected some from school districts too. So up on our school mental health website, we do provide sample templates and descriptions of how to do a needs assessment that takes into consideration mental health features that can be done in a school and with partners. That team or any team, a student support team, a SSSP team, however a district leadership team might set this up. And a mental health needs assessment tool and process is just really, really helpful to have. So you can consider these example tools that we have up on the website to help guide your planning. Also want to say we're going to talk later, light touch on this, but we're going to talk about a Texas database with school mental health resources later that can help you with this work too. And finally, I want to mention another tool on the website. We call this a comprehensive service delivery plan. This is a tool. It can be looked in many different ways, but this is an example of a plan across the tiers that one of our school districts has done that takes into account training, professional development, and mental health. What do we need to know? What knowledge and skills do we need to build? So what are we going to do this year? What are we going to do on tier 1 for mental health universal supports for all? And who's going to do it? And where are we going to do it? And what resources and partners do we need and have? And what are we going to do in tier 2? And what's our plan on tier 3? When we have students who need that extra treatment, recovery, like Dr. Harvey talked about, or supports. So we kind of have our plans laid out ahead of time. These are moving along and can be edited and improved and strengthened as time goes. Dr. Lopez.
Yes, okay, so moving to our next step is early identification and screening. So here is where we are assuring that we have the professional development that we need in order to recognize mental health concerns and early warning signs, and we know how to respond to those. And training can include our educators, of course, and our staff, but also our families and our students. How can they help recognize when peers may be having concerns, and how can they notify the appropriate adults in their lives to help support those students? So just a few examples: youth mental health first aid, ask about suicide, youth awareness of mental health, and there are many other ways to provide that professional development and training. This is also where we might think about universal screening to identify students who may need additional supports. So that means screening across all students in the school, but also targeted screening where students may have been referred for some concerns, and we want to provide some additional screening to really guide the team's decisions about what interventions may be most helpful to that student. And then, of course, ongoing screening to monitor progress. Are students' needs being addressed? Are they being able to move forward and progress and achieve the outcomes that are hoped for?
Real quickly, we have compilations, compendiums of tools done by some of our leaders in our universities available for you. We also have like a behavior observation or a student assistance referral form, whatever you would like to call it, that gives some of those early warning signs that teachers learn in mental health first aid. And this is part of your process that your support teams would set up, so a clear referral pathway is known and teachers are able to seek help when they need help. So hopefully that we can add people into our staffing patterns that are there to support our educators and our students. More about that later. Also, screening tools. This is one that was developed by PBIS in another state and then adopted nationally, and is all valid and reliable. And we've used it with teachers and superintendents who have loved it, just as another way for teachers to help quickly, just very quickly, be able to identify some internalizing and externalizing behaviors and needs of students that the teams can then look at and prioritize for further assessment and engaging the parents, and then to be able to help divide up and do some case management services and meet those needs.
All right, so our next step looks at mental health promotion and prevention. That is our tier 1 services. And this is where we're thinking about how do we both measure and enhance a positive and safe school climate for all students and staff. How do we set our school-wide expectations for positive behaviors and reinforce those behaviors that we want to see? How do we incorporate restorative practices within our schools? And how do we incorporate grief and trauma-informed school practices within our work? This is where we're thinking about our really important family engagement and inclusion practices. How are we building that community with our families? And how are we supporting students in learning skills such as how to identify and manage their emotions, how to regulate, how to set goals and create good organizational skills. How do they establish and maintain those positive relationships with both peers and adults in their lives? And how do we support them in responsible decision making and problem solving? So all really important areas.
Yeah, and all that can be connected to the TEKS. We've got TEKS for character traits and personal skill building. So nothing has to be in a silo. We have examples of school climate surveys. Some school districts use certain ones in partnership with a program that they're working with at TEA, which is great, or another grant. But we do have some examples available for you online. Next slide. We're going to try to finish up here in a couple minutes. So that we can move on to hear a couple other people that we want to give you an overview in this section. I always like to alert people to Project Restore, which is something that the commissioner absolutely loves. He said once that this has helped him in his own life and with his own children. And as everybody thinks about that and wellness, this was something that we developed right away, started in the spring 2020, right after COVID-19 hit in March, and started to develop and build. And it really is a nice piece for educators and any school support personnel or partners. If you want to sit down and go through these modules, feel free, they're free. Next slide. I already see you all networking in the chat, and I just have to stop for a minute to say thank you for doing that. This is the essence. Remember, the foundation at the base of the whole thing is you got to have relationships. And our mental health technology transfer centers, which Dr. Lopez also runs, it's a national, every section of the country has one of these. There's just more training that they provide and going deep, but they have fact sheets that talk about the frameworks for behavior and mental health. PBIS, the Interconnected Systems Framework, TEA certainly works with that, and you're going to learn more about that later today. How we integrate and connect mental health through our multi-tiered system of support. And it's just a great universal resource. And so we wanted to share that with you. We have these on the website as well. And we are getting to the last couple of minutes of this section.
Yeah, so quickly, we've got early intervention and access to specialized services. And so that is where, of course, we're thinking about identifying those specific and measurable goals for students, really what we're trying to achieve, making sure that our services are addressing unique strengths and needs, and the cultural and linguistic considerations of the students and families that we're working with, that we're using evidence-informed and evidence-based practices and programs, and that we are facilitating access to both school-based and community-based services and supports, and that we have systematic protocols in place to respond to emotional or behavioral health crises that may occur.
Just quickly, just want to share that we do have sample consent forms available on the website for you if you need them, sample student services plans, and guardian and notification of suicide concerns, safety plans, and other forms.
Perfect. Okay, so just a couple more steps. We've got our funding and sustainability step, where we're looking to make sure that we've got multiple and diverse funding sources to really support that full continuum. Those can be federal, state, local, including private funds and philanthropy funds. Our team is looking to monitor those new funding opportunities. There's some amazing funding opportunities coming out kind of all the time right now to address school mental health, which is exciting. We're looking to our partnerships for both perhaps funding, but also non-financial resources. What supports can they bring to the table? And we, of course, have strategies to support staff retention, because we know that staff retention is incredibly important. So here in your slides, just a number of different partners. You're going to hear from a number of them over the next few days.
Thank you.
Lastly, we've got monitoring progress and measuring impact. That is where we are looking to document who is using the school mental health and community-based services, what the quality of those services are. Are we maintaining fidelity to those evidence-based practices? And are we looking at different student subpopulations and making sure that we're seeing the use is equitable across those different populations? And then how are we documenting the impact of our services on, of course, important educational outcomes, as well as social, emotional, and behavioral outcomes that we may be trying to address? Are we reporting that impact comprehensively to our broad and diverse groups of stakeholders, to those who may be in the community, to our families, to our students, to our potential funding sources. And are we using the data that is feeding back into our needs assessment and our quality improvement processes to make sure that we're continuing to improve and address whatever unique needs may be coming up?
Just real quickly, an example of some data points and metrics connected at a school. Number of students screened for mental health services, referred for mental health services and supports, and then how many actually received them after referral. Those connections were made from AWARE. You'll hear more about AWARE later. Another slide for an example is, what were the reasons for referring students? And looking at that data at the end of a year and being able to look back and see anxiety symptoms, some combinations on the second one with some bullying and some attention attendance issues and some family issues, behavior management issues. And so that school leaders are able to then facilitate this and help feed into the assessment, needs assessment. And then parent feedback. We value our parent feedback. So parents agreeing and understanding, did their child get the support they need? Are they satisfied? How are the communications going? Would they recommend this service? And then parents, what is their view as they monitor, and we teach them and we do parent engagement, how to monitor the grades and improve in education and in learning, and in behavior and in attendance. And so this entire framework we'll continue to talk about. We're going to turn it over. We just went through the pathway, but at the base, leadership, family, and community engagement is so important in the foundation that we focus on staff wellness, and we're going to talk about that at the end of today, and mental health literacy, meaning that we understand some of these concepts that we're talking about. And speaking of mental health literacy, I'm going to turn it over now to Ashton Millett, but I'm going to say also that everything that we've just gone through is an entire full courses that education service centers are trained in, that could, that they take a while to learn. We have some self-service modules that will be coming as well that are already in the final stages. But I want to ask him to talk about what he's working on now on these statutory components. Ashton?
Yeah, thank you, Julie. Good morning and hello to everyone. My name is Ashton Millett, and I am a mental health program specialist here at the Texas Education Agency and on the mental health and wellness team within our supportive schools division. One of my primary projects is working with Dr. Lopez and some of our other partners at UT Austin with creating our mental health best practices list. A part of that is also stemming from statutory processes as well. So due to Texas Education Code 38.351, the legislature created these 8 components of school mental health. For the sake of time, I won't dabble all into every one of those, but through this statute, the 8 components of school mental health were created, and we are creating a research-based practices and evidence-based programs list using those components. And we currently have like a list on our TEA website that you can use, and it's functional. But a part of this project is making the list a whole lot more user-friendly for counselors, teachers, school leaders, community members, to actually be able to get the practices and programs that have the research behind it and evidence behind it as well. So this is a screenshot of our new, can you go back one more slide? I'm sorry. This is a screenshot of our most up-to-date, our updated website. One of the things that makes it a lot more user-friendly is now you're able to actually filter the programs and practices by component. So like I said, there are 8 mental health components. So you are now able to filter and find the practice that matches the component or components that you may be looking for out of a program or practice. And then we're also even able to filter the programs and practices by resource types as well, which also includes trainings, registries, and other resources too. I also want to give a quick shout out to our Project Aware team and the Mental Health Technology Transfer Center for supporting this project as well. One of the things that you see on the last bullet point is that we're continuing to expand and grow this project. So currently on this website, with the updated kind of like new user-friendly look, we have about 48 practices and programs on there. We're currently in a phase where we're transferring another about 60 or so practices and programs onto this website. So hopefully by the start of the new year, we'll have over 100 practices, programs, trainings, registries, supplements, all fit in the 8 mental health components as well. You can go to the next slide and I'll kind of show you what you will be able to get out of the website besides using the filter function. So we using our not only our folks at TEA and the Health and Human Services Commission, which is supporting this project, but also our folks and friends at the Education Service Centers are all working on actually creating these write-ups to put onto the website to make it, again, a lot more user-friendly and to get a lot more out of it. So within these write-ups, we have a description of the practice or program, who is actually intended for. My favorite actually is connected to the outcomes and the evidence behind it. So as you're able to use and search for these programs and practices, you know exactly what outcomes are going to come from those. And you also have some evidence behind it to show what you should be looking for as you evaluate those programs and practices as well. Also, one of the very awesome caveats as well is showing what the cost is even for some of those programs and practices, which I know is like very important for us and for you all in the field. So we dropped the link to this website in the chat. We're still beta testing and user testing this. So if you see anything that you might want to add to it in terms of broken links or some language, you can definitely feel free to reach out to us through email. And I will now pass it over to Chelsea to go ahead and share a little bit about our resources database.
Thanks, Ashton. Yeah, so good morning, everyone. My name is Chelsea Sorensen. I'm an education project specialist with the Region 14 Comprehensive Center out of Westat, and I support our school community health portfolio of work across Texas, Louisiana, and Arkansas. Our team at the Region 14 Comprehensive Center is assisting TEA with the continuous improvement of the school mental health resources inventory that was identified in Senate Bill 11 of the 86th Texas State Legislature. I'm here today to showcase the school mental health resources database that we launched earlier this year. And I know we're a little short on time, so I will provide a bit of background on Senate Bill 11 and go through a couple of slides to set the stage for you and why it was developed. And then at the end, I'll leave the QR code and URL up on the slide for you to peruse on your own. If we could go back one slide, please. So the requirements from Senate Bill 11 included that TEA is to develop a rubric for ESCs to use in identifying resources related to student mental health, including resources that are available to schools in their respective regions. It also requires the agency to share the revised rubric with the ESCs by December 1st in each odd-numbered year, and requires each ESC to submit a report on resources identified by March 1st in each even-numbered year. Next slide. And so additional requirements from Senate Bill 11 stated that from the resource rubric, TEA would develop a list of statewide resources available to school districts to address the mental health of students, including the following categories: communities and schools, program services, training and technical assistance on practices that support the mental health of students, school-based programs that provide prevention and intervention services to students, community-based programs that provide school-based or school-connected prevention or intervention services to students, school-based mental health providers, and public and private funding sources available to address the mental health of students. So based on feedback collected by TEA and the Region 14 Comprehensive Center on the 2019-2020 version of the resource rubric and data collection process, our two major goals in continuous improvement for 2021 and 2022 were, one, to address the quality of data using data validation and standardization to decrease entry errors and the need for extensive data cleaning, and two, to address the usability of the end product by creating a direct data entry system in a dynamic, searchable database that is easily accessible to stakeholders. So to do this, we developed a data entry form that was designed using the statute requirements from Senate Bill 11 that we just reviewed. And ESC staff were able to enter those resources directly into the database using an online form. We also built in data validation to increase the accuracy of information entered. For example, providing a requirement for 5 digits for a zip code or 10 digits for a phone number. From there, we developed the public website that includes a searchable database available statewide as part of the Mental Health Ecosystem Network in Texas. TEA and ESCs are able to share the database with schools, districts, policymakers, etc. And lastly, data on the website is always up to date. It updates live as ESCs enter new submissions or new resources. TEA is able to run reports about resource availability to include in the statewide mental health plan. And summary data visualizations on the website are available to view and download. So these are our features that we're really highlighting: that user-friendly public searchable database that's available. It's easily shareable with students and families, and TEA is able to run those reports on resource availability to include in the statewide mental health plan that can be shared. And then next I have the URL here, schoolmentalhealthtxdatabase.org. And you have the QR code there if you'd like to view on your phone. We have the mobile site that's always up to date as well. We have screenshots of some of those data visualizations that are available on the homepage, but do take a few moments to try searching for resources that are available in your ESC region. There are filterable categories based on keyword searches, intended outcomes, things like that. And then we also have some contact information. So if you see maybe opportunities to add a resource in your region that are not currently there, feel free to reach out to your ESC. There's an About tab on our database website that you can go in and contact your ESC person to get that entered into the database. And like I said, it's always kept up to date and will update live. Any questions? Or Julie, do you have anything to add? I know we're running a little bit short on time.
No, I'm going to say Chelsea will be available, and I just want to thank you, Chelsea and Ashton and Dr. Lopez for this time together. Please do QR code that. And Rohana gave us a great quote to kind of end this session from the great, amazing coach, Vince Lombardi, that individual commitment to a group effort, that is what makes a team work, a company work, a society work, a civilization work. So that's very profound. And we want to thank you again for joining us today. Thank you for listening to the overview. And it is now time for our wellness break.